Hi friends, this is Juliet from Prega News, and nowadays, as we all know, cervical cancer is a very dangerous kind of disease which is going on. So in today's video, I've decided to discuss signs and symptoms of cervical cancer. So let's get started. Cervical cancer symptoms. In most cases, cervical cancer does not cause noticeable symptoms in the early stages of the disease. Routine Pap screening is important to check for abnormal cells in the cervix, so they can be monitored and treated as early as possible. Most women are advised to get a Pap test starting at the age of 21. The Pap test is one of the most reliable and effective cancer screening method available, and women should have early exams by an OB-GYNecologist. However, the Pap test may not detect some causes of abnormal cells in the cervix. However, the Pap test may not detect some cases of abnormal cells in the cervix. The HPV test screens women for the high-risk HPV strains that may lead to cervical cancer. It is approved for women over age 30. Here in this picture you can see this is the uterus and cervix, and it is the vagina. But in case of cancer tissue, how it becomes exactly looks like this, and this is how it bleeds. Now we will know what causes cervical cancer. Most cervical cancer is caused by a virus called human papillomavirus or HPV. You can get HPV by having sexual contact with someone who has it. There are many types of HPV virus. Not all types of HPV cause cervical cancer. Some of them cause genital warts, but other types may not cause any symptoms. Most adults have been infected with HPV at some time. An infection may go away on its own, but sometimes it can cause genital warts or lead to cervical cancer. That's why it is important for women to have regular Pap test. A Pap test can find changes in cervical cells before they turn into cancer. If you treat the cell changes, you may prevent cervical cancer. Cervical cancer. Here you can see this is our uterus and this is the cervix, and here this is the cervical cancer. The white portion over there in your vagina is a cervical cancer. Here you can see how it looks like. Generally, the symptoms for cervical cancers are pelvic pain, unusual vaginal discharge, low back pain, pain during sex, vaginal bleeding after sex, vaginal bleeding during periods, longer or heavier menstrual periods than usual. So ladies, if you find yourself suffering from any kind of symptoms among this, do not delay and directly move to your doctor for a checkup, or else you can go for a Pap screening. Now, what is vaginal bleeding? This includes bleeding during periods, after sexual intercourse, or post-menopause bleeding. Unusual vaginal discharge. A watery, pink or foul-smelling discharge is very common. Abnormal vaginal discharge is another possible sign of cervical cancer, though this symptom has many causes as well. There may or may not be an odor associated with the discharge, and the discharge may be of any color, light or heavy, intermittent or constant. Overall, vaginal discharge due to cancer tends to be reddish brown in color, but this can vary significantly. Most women have vaginal discharge at some time, and most of the time this is related to ordinary hormonal changes. If you are concerned, you can check out these tips on when you see your doctor with vaginal discharge. Pelvic pain. Pain during intercourse or at other times may be a sign of abnormal changes to the cervix or less serious conditions. Pelvic pain can be a symptom of cervical cancer but has many other possible causes as well. It's important to note that pelvic pain can also be an early symptom of ovarian cancer, a cancer which is also much easier to treat in the early stages of the disease. That said, the most common causes of pelvic pain are benign conditions such as menstrual cramps. Pelvic pain may be constant or intermittent, sharp or dully and achy, and localized or spread throughout your abdomen and back. Pain during intercourse, also called dyspareunia, could also be a symptom of cervical cancer. Discomfort during intercourse that persists should always be evaluated, both for the physical conditions that may be responsible and for the emotional impact it may have. Signs of advanced stages of cervical cancer. Cervical cancer may spread, that is, metastasize, within the pelvis to the lymph node or elsewhere in the body. Signs of advanced cervical cancer include weight loss, fatigue, back pain, leg pain or swelling, leakage of urine or feces from the vagina, bone fracture. Hope you guys have learned about the signs and symptoms of cervical cancer. In my next videos, we'll come up with how to treat the cervical cancer. So thank you for watching my videos, and guys, please do not forget to subscribe, share and like my channel. That is Prega News. Thank you.